Good morning, all respected teachers and my dear colleagues and faculty. I'm Dr. Ganesh Ankam. My topics today is my experiences with innovative IAOS invasive and non-invasive methods of orthopedic problems. I have included almost all combination of IAOS methods in my cases. First case, this patient is around 60 years old, had severe osteoarthritis. Myself and Dr. Amar Babu performed a successfully knee arthroplasty at my friend's hospital. Post-operatively, patient was absolutely fine, but the patient has diabetes and hypertension. After few days, I lost his follow-up. Then he landed up after 3 weeks to my friend's hospital. After discharge, he went to the osteopath to have a ROM exercises, like he did a vigorous flexion exercises, and he developed a mild wound gapping and self-treated with talc powder as a stitch powder. And he presented to my hospital with severe pain, fever and chills. Then on inspection, I saw the wound is like this. Then when I opened one stitch, somehow he covered all with the talc powder. I removed all that and there was a 1-inch hole. I just put my finger into the joint. So I could feel implant, poly and some remnants that were powder balls. Then his lab reports were ESR was 120, CRP 64, WBC were 23,500 and RBS was more than 350 and HbA1c was 9.6. And we decided to open the joint completely and debrided thoroughly, and whatever the tissue we have seen that is not viable, removed all the tissue and wound irrigated with ozone. We have irrigated thoroughly for almost 45 minutes and we kept a drain and we changed the poly also, and daily we have drained with ozone saline. After washing, we gave ozone infiltration into the joint, kept for almost 15 minutes. We did like this for 2 weeks and given IV antibiotics for 3 weeks and oral antibiotics for 6 weeks. Before, when we operated, we achieved only 90 degrees of flexion, but to my surprise, after all the wound healed, we got almost 110 degrees of flexion, and the patient was very happy in spite of struggling all these things. He was very happy that he got almost 110 degrees of flexion. He was afraid of going under all these things. The other leg, right side also, he needed a knee replacement, but he said, "Sir, I don't want any knee replacement. No, you just give me the block. I will be happy." To my surprise, he is very happy with intra-articular ozone plus beta 2, beta 3 blocks and Salhotra portal to the right side. He is very happy with the both legs now. And the second case is complex rheumatoid arthritis with complicated Baker cyst. Patient is very young female, 17 years old. Chief complaints were multiple joint pains, small and large, progressive swelling and inability to walk. She came to our hospital in a wheelchair. We admitted her and thoroughly investigated. We knew that she had old reports stating that rheumatoid arthritis and joint swellings and mobility impairment was there. I have given her started with IV steroids and Mukherjee regime. Given her 5 major autohemotherapies and 1 hydrogen immune drip. After that, we achieved complete symptomatic relief with Mukherjee regime, and thanks to Mukherjee regime, we gave her 5 MASTs also. She was happy for almost 6 months to 7 months, but suddenly she developed a large and hard tender cough swelling. Then I asked ultrasound. The ultrasound suggesting was suspicious of malignancy. In MRI, I got a complicated Baker cyst of size of 12.4 into 7.1 into 3.5 centimeters. So it was connecting to the knee joint. So I had a discussion with Prakash sir and a surgical oncologist. Then Prakash sir asked me to do a aspiration and ozone infiltration, but oncologist advised for surgical excision of the complete cyst. Then I aspirated almost 500 ml of fluid and ozone infiltrated in the same needle only. The swelling has extended to the quadriceps. Then I thought prompting consideration for surgery, but surgery was postponed for 3 weeks due to surgical oncologist availability. Then when he came back, then we asked that patient to come for surgery. On follow-up, swelling completely resolved and the patient was asymptomatic. Surgery was not at all required. She is very happy and there is no tenderness, no hardness, nothing was there. She is very happy. And continuing her on Mukherjee regime on and off in once in a 6 months MAST. So this was the before aspiration and this is after aspiration of 3 months. So the third case, Again, a rheumatoid arthritis with stiff wrist joints, bilateral wrist joint stiffness. She had treatment for almost 3 years somewhere else, and she developed stiffness in all joints, but more on both wrist joints. I have given her intra-articular ozone. This is after 1 year. Her wrist joints are very comfortable. She is doing her daily activities. The patient is 55-year-old female, had stiff knee after a knee joint surgery. She had a history of fall and HOFA fracture. We fixed her fracture with Herbert screws, and we kept her for non-weight bearing for 8 weeks post-operatively. But she developed stiffness. Knee stiffness was around 30 degrees. Her daughter is a MBBS. She was intern then. She knew that post-operative stiffness will give more trouble to her, and she may not get recovered with this knee stiffness. Then she asked me, how can we go with the stiffness of the knee to release? Then I said, I'll try to give intra-articular ozone in a stage-wise. So I gave her stage-wise intra-articular ozone therapy for 4 sessions in a gap of 1 week. Actually, I thought first I want to release a posterior capsule. So I have manipulated after giving ozone, and she recovered completely, and then followed by physiotherapy. Rehabilitation was given to her. She got almost 95 to 100 degrees of flexion. She is happy now. Non-healing chronic ulcer, grade 2. For almost, she was getting dressings for almost 2 years in a corporate hospitals, big hospitals in Hyderabad. She was in follow-up in a NIMS hospital for 2 years. She was given regular dressings and offloading footwears without any improvement. She came to me. I just debrided the wound and given her ozone dressings to her. And this is the day 1 picture in the left-hand side, and the day 3 in the middle one, and day 5 is the right-hand side. Completely healing achieved within 7 days. This is her grade 2 after 7 days. I didn't get any surprise of seeing this, but the patient is surprised because she spent almost 2 years in a big hospitals every day dressings, but we have treated her in a 7 days. She was very happy, and she thought such a great things happens in such a small towns also. She was very happy for that. And the patient is Gnaneshwar. He's traveled almost 300 kilometers from my place. He got a diabetic ulcer, necrotized calcaneum, septic shock, and uncontrolled sugars. Calcaneum was completely necrotized. And in Hyderabad, few big hospitals were suggested him for amputation. He came to us. My approach was debrided all necrotic tissue, infected tissue was removed, and wound care was done with vac therapy and ozone dressings applied. Ozone irrigation done through the same pipe of vac dressing, and sugars was controlled initially with insulin, then followed by low dose Mukherjee regime. And definitive treatment, I have done a skin graft to that patient. He was recovered completely. This was the after debridement picture, and this is after vac therapy and ozone irrigation. The very good granulation achieved. Then I applied a skin graft. And this patient had a filariasis on the left leg, and he had a pain and developed a cellulitis in the leg. So he had completely bad wound on the leg. He applied a Jendu balm on that inflamed leg and developed all necrotized skin. Some practitioners were doing daily dressings, but that wound was not healing. This was after vac dressing and ozone irrigation, and achieved this. The wound was circumferential to the leg, so I have applied a skin grafting to that patient with major risk, and this is successful outcome. After 3 years, this is the picture of his leg now. This is the stage 4 bed sores. Patient had fall from height in Dubai and had multiple spinal fractures and with spinal cord injury. He was underwent spinal fixation there in the Dubai, and he was shifted to India. After 3-4 weeks, he developed a stage 4 bed sore in the back and exposed sacrum with the foul smelling with septic shock. We have given him a vac dressing with ozone irrigations every day, and this is the after first setting of vac therapy with ozone, and this is after second. So I have covered little flap with skin grafting, and the outcome was significant wound healing and infection resolved achieved. Thank you.
Thank you, doctor.